Hi, this is Tim Feaser with Freaky50Fitness.com, a website dedicated to preserving your wealth by rediscovering your health and its benefit to our nation's future. Today I'd like to talk about costly addictions. You know, there are many vices we often enjoy that become addictive, and whether they're harmful or destructive depends upon, well, the addiction. Whether it's drugs, alcohol, cigarette smoking, food, or video gaming, too much of anything can really ruin your life. It's certainly well documented what drugs, alcohol, cigarette smoking can do to your body, not to mention excessive overeating. You know, with respect to smoking, insurance companies actually will charge you more for life and health insurance if you're a smoker. There's one example of how an addictive habit becomes very costly. Cigarette smoking is costly both now as well as in the future. How is it more costly now? Well, we just told you that insurance companies charge you more if you're a smoker. But also, I'm not a smoker, but I did some research today and discovered that a pack of cigarettes costs roughly $6. Now, if you smoke a pack a day, do the math, that's about $2,000 a year. Now, the average U.S. household income is about $47,000. Let's just say it's 50. 2,000 divided by 50,000 is about 4%. So 4% of your income spent on cigarette smoking for all you smokers out there. I don't know, to me that seems like an awful lot for a habit that likely kills you quick. Listen, your future costs are associated with your increasing healthcare spend in the future, associated with your potential development of chronic obstructive pulmonary disease. Let's just say COPD for short, since it's simpler. COPD results in severe bronchitis and emphysema, two conditions having a severe adverse impact on your lungs, likely resulting in you becoming a chronic needs patient in your future. Chronic needs patients spend a lot of money on their future healthcare expenses, keeping them functioning, hence depleting their wealth due to their poor health. So I've highlighted cigarette smoking as one addictive habit that is costly now as well as very costly in the future, resulting in higher healthcare usage, which results in higher average healthcare costs for the rest of us. You know, you may think your employer doesn't care about your lifestyle habits and their impact on your health, but you might want to think again. You know, last summer I was up late one night and I was watching an old rerun of 60 Minutes that had an episode about a company in Michigan called Waco, whose president instituted a new policy whereby if you were smoking, you would be fired. Now, he put in a smoking cessation program to assist his employees with their smoking habit, helping them to quit, and many were successful. However, there was a subset of employees who just couldn't kick the habit and hence were kicked out the door. You know, obviously this president has made the link between the adverse lifestyle habit of smoking and its negative impact on his future healthcare expenses. You know, part of the unemployment problem in the U.S. is associated with jobs going overseas to emerging economies with cheaper labor. You know, the cost to U.S. corporations of hiring us Americans is our wages and our benefits. Now, our benefits, a large component of which is our health insurance. You know, the health insurers often get blamed by the media for the increasing cost of health insurance through their premiums they charge, which is true. However, as an actuary working in that industry, I can tell you that those health insurance premiums are really based on the underlying costs of healthcare services delivered to, guess who? Us. So if we're using a lot of healthcare services, which we are, healthcare insurance premiums are going to continue to rise. The insurance companies are basically just passing along the costs of the care. Our employers also are recognized as our bosses when it comes to our incomes. But do you want your employer to control how you live going forward? Now listen, if you've checked your employee website, you may notice that there are wellness programs that are targeting you at the moment. Whether they give you encouraging tips on how to change your diet, encouraging tips for fitness, heck, some of them are even having instructors come in and provide exercise programs for you. That's all intended to influence your behavior in a positive way, encouraging you to become more healthy in your day-to-day living. They recognize the impact that that could have on their future healthcare expenses in a positive way. You know, entire countries are getting into the act of trying to manage how people live and help them with their dietary decisions. Denmark, for example, recently passed a law whereby foods containing a higher content of saturated fat would be taxed higher. Something to think about here in the U.S. So listen, as we all continue working in our pursuit of happiness, now and in retirement, as the main users of healthcare services, it's important that we migrate away from the current destructive habits and sedentary lifestyles we lead to more balanced and healthy ones. So again, taking responsibility for your own health can make you become part of an evolving solution to our nation's healthcare cost crisis. Again, my name is Tim Fieser with Freaky50Fitness.com. Wishing you a great day and encouraging you to take action to get healthy, to stay wealthy.